today's topic would be on the accuracy of reports so that our patients could start their perfect treatment and take care of their health.
Yeah, I think it's very, very important in today's world where we all are so busy and sometimes we think that we are healthy, but it turns out to be other way around.
Right. So, Doctor, if you would like to add something, I mean, more information before we actually start with our questions, like how important is the reports, the accuracy of reports from patient point of view, because there are so many labs with different reports. So how much important is it?
See, a clinician is as good as the labs. So if the labs are right, they are the main pillars for making a diagnosis. The labs are accurate, then the way we treat patients will definitely get impacted. As a clinician, as a doctor, I will be able to obviously make better decisions related to the patient's diagnosis, disease, infection, and then treat it also more accurately with the minimum antibiotics, minimum medications. So, and also use drugs which can have the faster results.
Okay. And how will we get to know that this particular lab is really good for us to get, that particular test done? How will you get to know? Because there's so many labs available outside.
So I think it will come with trust, and it is all about like when we use a particular lab report, then how are the reports being reported? First of all, uh, it is basically the reliability, the accuracy of the results, and अगर एक दो बार मतलब आपके रिजल्ट सही आते हैं, so then the clinician starts getting the trust on that particular lab as well. Plus, it's very important that the lab results should come in time, like it should not be delayed. So the quicker lab results arrive with the doctor as well as the patients, the faster the medications or the appropriate medications can be initiated.
Okay. So, Doctor, as I just mentioned at the beginning of our live interview, that we have set a few questions with us. So, my first question is, what is the importance of accurate medical reports in the diagnosis and treatment of diseases?
I think when it comes to reports, so we can actually segregate it into common diseases and very rare diseases or complex diseases. But whenever we get the test done, the lab results have to be, first of all, the labs have to be available, they have to be reliable, quick, and of course, cost effective. And now we are in the flu season or in the fever season is going on. There's so many patients who are having fever, and fever can be because of so many conditions. So sometimes it can be because of sore throat or viral infection. It can be dengue. It can be at times malaria. It can be because of typhoid. It can be a urine infection. It can be because of other diseases, say rickettsiosis, like other complex infections. It can be blood infection. So it's not that fever is a particular diagnosis. What is the cause of fever? That is very important. So how do we arrive on that? So first is based on our clinical acumen, जो patients के symptoms हैं, पूरी history लेके a doctor, a clinician arrives. Then based on what we think is the likely cause of infection, then we do particular test. And that helps in arriving and giving us the particular diagnosis. जैसे अगर मान लीजिए patient fever का है और उसमें कोई symptoms नहीं है, but fever, and if suppose we do a particular test which is like dengue, say simple, because so if dengue is positive, NS1 antigen is positive, we have come at a diagnosis. Then we don't have to really give unnecessary antibiotics for that patient कि इसको हम सेफेक्सिम भी दे दें या और कोई एंटीबायोटिक भी दे दें, because it's not typhoid, it's not a bacterial infection. Dengue is a viral infection. So we can give appropriate treatment and also warn the patients that these are the possible warning signs, what precautions you have to take, what treatment you have to take, you have to hydrate yourself. All that is very important.
Okay.
So
So,
that
doctor, my
is
next
how I think, the result, the importance of test is absolutely extreme.
right. So, doctor, my next question to you is that how can accurate reports change the course of your treatment?
Absolutely. Accurate results can really make a difference. I just gave an example of fever, where if suppose fever, if you have sore throat, and if it turns out to be, suppose you've done tests for influenza also. If influenza is positive, then you don't have to give antibiotics. और इवन ब्लड टेस्ट अगर मान लीजिए इन्फ्लुएंजा पीसीआर नहीं करा पा रहे हैं तो सीबीसी सीआरपी बिकॉज दैट कैन आल्सो हेल्प अस इन मेकिंग और अराइविंग differentiating between viral bacterial infection. Now sometimes some people can, recently I had a young boy who had this lymph node of the neck. Now he got tests done and he also went to multiple clinicians. जो भी टेस्ट थे, somehow, the interpretation of those tests is also very important. So he was getting treatment for tuberculosis, and then he had these multiple lymph nodes, and then we again got the various investigations done because clinically, to me as a ID specialist, it was not looking like TB. So that is why what we did was we further diagnosed, and then with the proper test, it turned out to be lymphoma, cancer.
Oh,
So yes, so one has to decide on which test which have to be done, and interpretation of those tests is also very important.
doctor, regretfully, cancer has become very, a common disease now because, earlier, I mean, few people used to suffer from cancer, but now it is a common one. So, doctor, my next question to you, can a small error in our report lead to a big health issue?
Yes, bilkul. Like even if, see, we can take an example of diabetes, which is very common. India is the diabetic capital of the world. So if suppose your results for diabetes HbA1c is not appropriate, if it is showing a controlled sugar, whereas if it is uncontrolled, and if your fasting sugar or pp, postprandial sugar is not right, then it can result in a complete uh, not so good control of the sugars, and sugars are not controlled, that can lead to many complications. It can result in heart diseases and so many other problems as well, right? And if suppose you have patient is having a urine culture positive, right? Now a positive urine culture is not always UTI. So a patient is having fever, and if suppose a urine routine or a urine culture is positive, but the sample has not been collected properly, then it is not UTI. So there can be misdiagnosis and mistreatment. Similarly, we have certain tests, for example, the Typhi.IgM test. And a lot of times, see, yes, it's a serological test. It is not a specific test. But if fever panel is done or if this particular test is done, it may be positive and it may be false positive. So that can again result in misdiagnosis. So right treatment is extremely important, and of course, right interpretation of those reports is also very right test and right interpretation of those tests is also very very important.
So, doctor, just correct me. You just mentioned serological treatment. Am I right? You just mentioned this word, if I'm pronouncing it correctly. So, what is that? Please shed some light on that.
Uh,
Serological treatment, you said.
Serological treatment.
Serological treatment. Okay.
Okay. Serological treatment is when we detect antibodies. So when we arrive at a particular diagnosis, there are five basic approaches which are adopted. One
Okay.
is related to the direct, stains, gram stains which are done. We are talking about microbiology here. So gram stain, then we do sometimes cultures, which includes blood culture, urine culture, and it can be sputum culture. Third is the serology. Fourth is the antigen detection, and fifth is the PCR, the molecular PCRs, like the COVID-19 PCR. So we have COVID-19 antigen, dengue antigen, and dengue में then we do this IgM antibodies. So
Yes.
IgM is an antibody.
Yes.
IgG, dengue, is also an antibody. So this becomes a serological test where we are detecting the antibodies.
Okay.
COVID-19 antibody test is a serology.
Okay.
It's anything which detects antibody is a serological test.
So thank you very much.
It's a
I
blood
think
test. These
that's
are
a
blood tests. Yeah.
that's a very simple. I mean, you have just explained to us in a very simple term. Like for like layman, I think it's very easy explanation for us. So, doctor, next question I would like to ask you. So, what is more important, starting it early or starting right, when it comes to treatment, when it comes to reports?
I think both, right? Yeah. And also it has to be the right treatment. It has to be right treatment and ASAP. Right.
Okay.
So yeah, so that will come obviously with the clinical acumen and with writing the appropriate test and the right test. So, which tests have to be ordered so that we can arrive at a particular diagnosis early? That is also very, very important. So, both is both is important, right test and of course starting the right treatment ASAP. Because a lot of times, see for example, a patient coming with fever, and whether it is typhoid or whether it's a dengue or it is viral infection, the results sometimes may take a little while. But as a clinician, it is for me to obviously upgrade or have that capacity to initiate the treatment before I get the results. But getting the right results definitely allays my anxiety. I know that this is dengue, I know that this is typhoid. For dengue I don't have to give antibiotics. For typhoid I have to give an antibiotic, I have to give it at the right dose and for this particular duration. So diagnosis definitely relieves the doctor as well, not just the patient, because the doctor is really worried when a patient is not well. I mean, it really, even single patient not well is, it gives, it's there in the mind all the time.
It's a lot of concern for you, right?
Absolutely. Yeah. I think for every, um, any clinician, this will hold good. Yeah.
Okay. So, doctor, how can a patient ensure that he has received an accurate medical report?
Okay. So, I think how it will be like, to be honest, it will come with, okay, first is it has to be a good brand. That also really makes a difference. And then if the doctor believes that this particular lab is good and they are giving the right results, then it will I think the trust and experience really will help in this particular way. It is the experience with a
Okay.
particular lab. Yeah.
So,
And it
doctor,
will
we
not
have
match. Like a lot of times when we feel that somehow it is not matching, that's when we will cross check. If it is
okay.
not matching, then we cross check. And probably you can cross check it with some other lab also to see whether the previous result was right or wrong. Right? So that way you can cross check, you can decide, yes, that the previous result was right and I have to stick with it.
Okay. There's a very interesting question coming in, Dr. Neha, that how do timely and correct report help in early disease detection and better treatment?
See, uh, timely detection is can change the whole game. If it is early detection, you can get the right treatment ASAP. Otherwise, for example, if a patient has simple fever like dengue, and if the patient is given antibiotics, the antibiotics can result in drug fever. So I had a patient who came to me from Allahabad. The girl had only dengue fever. But because this girl also received antibiotics, she started having fever after 7 days. And that's when they got worried and then they came. So it was drug fever. So reports can completely change the diagnosis. I mentioned about a patient who had lymph node and it was not TB but cancer. Similarly, whether if a patient is having lymph node is So so similarly, suppose if it is TB and whether it is susceptible or it is a drug resistant tuberculosis. So all this can make a huge difference in the diagnosis, whether the infection is of the heart or something else,
Okay.
whether it's vasculitis. Yeah.
Right. Okay. Um, Dr. My next question to you, pacify, how would you pacify a patient who is worried about the accuracy of his report? There are some patients who are really worried whether their reports are accurate or not. So how would you pacify that patient?
So, the best way first is from where has the patient got that report done? And if
Yeah.
I think the report is from a lab where I have trust and the reports usually come right, then I will say that I think it is matching with your, you know. So, for example, I had a patient yesterday who had who just got his HIV done and it was positive, it was reactive, and then he got it done from another lab, and he said that I have no symptoms and I have this HIV which is reactive, so do I really have symptoms? So when I examined him, he had this tonsillar area of pharynx which was congested. So this is one of the features which we see in patients with HIV. So no symptoms at all, but they may have this tonsillar or the pharynx are congested. So that is one. And of course, there was some sexual history also, which was there. So that correlated with the symptoms. So then, based on clinical correlation, we decide. And then, of course, we can go ahead and further repeat the confirmatory test, either repeat the test from a different lab or go ahead and confirm the test by further performing certain other tests. So that's how we will, you know, try and convince our patients.
Okay. Doctor, what role do follow-up test and monitoring play in ongoing treatment?
Yeah, so follow-up is extremely important. A lot of times, when we start the treatment, we would want to follow up based on the what the patient's illness is, what the disease is, what disease are they suffering. For example, if suppose it's thyroid problem, then probably we can follow up at 8 weeks. If it's diabetes, which is not so complicated, then again at the 2 months time we can repeat the test and check. But suppose it's a patient who's having fever and we've started certain treatment, then we may want to do a 24-hour follow-up or even a 72-hour follow-up. For our HIV patients, we may want to do a more frequent follow-up. So it all depends. The follow-up is very important. And a lot of times, see, a doctor may write that you have to take treatment for say 5 days, 3 days. But you may become fine, but it is important to follow up with the doctor so that they may want to continue, may give you a little longer, or may want to give you advice so that you don't get that particular infection again. What are the precautions which you can take so that you can, have a healthy life? So, because of those reasons, also it's important to have a follow up and not just continue or discontinue the medications.
Okay. Doctor, can you share a case where accurate lab report actually made a significance in treatment?
Yeah, absolutely. Multiple cases on a daily basis. If it's like, for example, I had a patient who was having diarrhea for a long time. And then it was like when we got the imaging done, it showed that there is some ileocecal abnormality, like there is constriction of the intestines. And finally, when he got operated, so it was like whether it's Crohn's or it turned out to be histopathology made that it is Crohn's. But his whole symptoms, all of that was suggestive of tuberculosis. So based on his clinical symptoms, we actually gave him treatment for full 9 months. So if the test reports are not right, then it can lead into a completely different direction. So interpretation of the right reports have to be right. And again, interpretation of those results also has is also very, very important.
Okay. So, doctor, is it possible to diagnose major illnesses just from a routine checkup?
Yeah, so majority of the illnesses can be diagnosed on your regular health checkups. So when we do a CBC, CBC is magical, like a complete blood count. It's really, really magical. So here, looking at the hemoglobin, looking at the total leukocyte count or the WBC count, then looking at the platelet count, and ESR, peripheral smear. This can give us a clue about so many things. Again, in the WBC, if there is neutrophils, so whether neutrophils बड़े हैं, lymphocyte कम है, ज़्यादा है, eosinophil count, monocyte count, eosinophil count, if it's showing eosinophilia, so it can be allergy, it can be worm infestation, it can be certain other infections. Neutrophil, so even like for example, if we say talk about fever में मान लीजिए if you're doing just CBC, right? So here dengue may there is never a elevated WBC count. So if your counts are elevated, it's not dengue. And when we talk about major illnesses, any of these can really the CBC can make a diagnosis, and then it comes to kidney function test. So kidney may problems can be detected, liver function test can be detected. If there's diabetes, so like a lot of times patient may not have any symptoms and they turn out to be diabetics. So fasting blood sugar, HbA1c, cholesterol problems, thyroid related problems, they can also be detected. So majority of it can be detected, but besides the blood test, I think X-ray and ultrasound is also very important. Coming from a personal experience which I had recently, so I underwent hysterectomy just last week. Hysterectomy is a major surgical operation which includes uterus removal. So I think as women, like and of course we are multitasking most of the time. So a lot of times simple, and I am quite healthy, but and also lifting deadlifts of 50 kgs. So despite that, there was some problem related to the menstruation,
Okay.
but I thought like everything is fine and I got my blood test done, which was fine as well. But then subsequently it is the ultrasound which picked up. So blood tests are very important, but sometimes just X-ray and ultrasound, ECG, etc., they can also pick up majority of your problems.
Okay. So, doctor, what is the major myth you have heard about diagnostic test?
Major myth is, I mean, I can't. Major myth would be that um, all tests we have to do uh, all tests at a particular मतलब कोई अगर प्रॉब्लम हुई तो सब टेस्ट करा लो वैसा
Right.
सारे टेस्ट जरूरी नहीं कि आप सभी एकदम से ही सब टेस्ट करा लीजिए
Right.
नहीं we have to individualize the test like आपको क्या जरूरी है वो important है not like as a panel get everything is not really needed. Ideally, it would be individualization of the test.
Okay. So, doctor, आपने conversation के start में बताया था कि India is the diabetic capital now, right? So, if you
Yeah.
could tell me how much percentage of India is diabetic now?
So, how much percentage? But yes, I think close to probably. See, I can't give you a correct figure right now, but adult population close to I think 20% probably is impacted with it. Yeah, 20 to 30%. Yeah, yeah.
So, that's quite surprising, right?
Yeah, absolutely. Yes, yes, yes. Yeah. Not surprising, but it is, it's because I think of the lifestyle. Definitely, we are seeing more and more patients developing diabetes. So that is why I think a regular checkup is extremely important. I mean, recently, one of my friends, husband who was lean, एकदम पतले हैं वो तो मोटे भी नहीं हैं, but of course on a checkup he was feeling a little weak, and then on a regular checkup he was found to be diabetic. So it's not always those who are hefty, but there is always a chance of diabetes, especially when there is a hereditary, there are genes, so that can really impact.
Okay. So, doctor, you means that you
And
actually
with
mean
the
to say.
current and with the current my own experience, I think my belief in the regular health checkups has even gone up.
Okay. Well, there is another question from our viewer that how important is accurate medical reports? How important is accurate medical reports in the diagnosis and treatment disease?
Accurate medical reports are the most important. The tests are going to guide towards the right diagnosis and the right treatment.
And how often we should get tested?
The annual health checkups, I think we should do it at least like annual. It should be annual. Yeah.
Right. Okay. So, doctor, anything else? I mean, you would like to add from your side as far as the accuracy of report is concerned?
No, I think right results are extremely important because they can either they can completely misguide also if the reports are not right. So the accuracy is the most important. And the test results, as I always say, they have to be available, they have to be reliable, quick, as well as cost effective. The turnaround time is also very, very important. So all these a reliable, um, a reliable lab is extremely, extremely important.
Okay. Doctor, how can a wrong diagnosis impact a person's health? Wrong diagnosis का कितना असर पड़ता है एक person की health पर?
रॉन्ग डायग्नोसिस होगा तो रॉन्ग ट्रीटमेंट मिलेगा, रॉन्ग ट्रीटमेंट होगा तो पेशेंट ठीक ही नहीं होगा. इट कैन इवन लीड टू डेथ.
Okay. Any case you have encountered in the past where the reports were not accurate and it actually had negative
Yes, so I
outcomes
did,
later?
I mentioned, right, the patient who had lymphoma, he had he had lymph nodes here, and then
Okay.
he was being treated as tuberculosis, but it was cancer. Similarly, like it can be, if you have a lymph node, it can be other causes like fungal infections. So I had a patient who had come and she was told to have cancer, but it turned out to be a fungal infection. So based on, yeah, so a particular symptom can be because of an infection or a non-infectious cause. जैसे किसी को फीवर चल रहा है, बहुत दिनों से फीवर चल रहा है. So fever can also be because of certain disorders like vasculitis, it can be TB, it can be infection of the heart which is there, which is not being diagnosed. So अगर treatment diagnosis ही नहीं हुआ है तो treatment कैसे होगा, है ना? For I also had a young girl who had a dental brace, and then she presented with weakness and difficulty in walking. फिर MRI कराया तो she had a brain में abscess या pus जैसा था, which was thought to be tuberculosis, and she was receiving TB treatment. But it was not TB. It
It was
was a bacterial infection which had happened from a dental brace, and it had gone up. So yes, so everything depends upon the right diagnosis. If the treatment, if suppose your results are showing granulomas. So the granulomas may not be always TB. It can be because so many other conditions. And a patient, for example, is having fever because of, say, it can be a UTI, and typhoid otis, or there is amoebic liver abscess. There is liver में abscess आ रहा है या पस बन रहा है. And if your typhoid dot is positive, IgM typhoid dot, so we may think that it is typhoid, but it is not typhoid. There is some other cause for it. There is actually infection or pus in the liver which is causing the problem. So, right treatment can it is almost equivalent to a patient's life. It can save life.
definitely.
Right,
Doctor,
and
why do
right test can save lives. Test. right test.
That is why accurate reports are important. And
Absolutely. Uh,
doctors, but I've noticed sometimes that doctors do recommend retesting when we are already fine. Why does it happen so?
can you please come up again?
Yes, sure. I'm saying that, sometimes doctors suggest retesting to be done, even if we are feeling fine. Why?
No, so I'm sure the doctor is saying that you retest because they feel that this particular report is not matching with you. If they're suspecting something, and if suppose the test is not appropriate, that's why they will be suggesting you to retest that particular report or that particular test result. And sometimes it may be as a follow up that probably they've given the treatment, so to assess कि हाँ भाई ये treatment सही चल रहा है या फिर बाद में एज अ फॉलो अप कहीं वापस से तो नहीं प्रॉब्लम हो रहा है, उसके लिए दे these are the various reasons why repeat testing is probably being advised.
Okay. Doctor, what kind of mistakes do patients make while they search for a reliable diagnostic lab? What kind of mistakes do they make? If you have ever noticed in the past.
So I think a lot of times it turns out to be cost and probably the of course cost or financial um, reasons probably would be that they would choose a particular lab as compared to the other one. This could be one of the major factors.
So cost does matter, right?
Cost,
Uh,
absolutely. Yeah.
okay. So
Hmm.
are annual checkups enough? Are annual checkups enough, or should we be doing more?
So it also depends upon कि आपको कोई problem है कि नहीं है. अगर आप fit and fine, healthy है, so after a particular age, I think annual checkups are fine. अगर आपको कोई problem है, जैसे आपको diabetes है, या फिर आपको hypertension, cholesterol है, तो then obviously we need to do a little more to check our heart condition, etc. So depends. um, If you are fine, then annual checkups are sufficient in most cases.
Right. So you mean to say अगर underlying condition नहीं है, तो annual checkups are fine. Otherwise, of course, we need frequent checkups.
Yes, absolutely. Yes, yes, yeah.
Okay. Doctor, is there such a thing, too many tests? Because I've
Too many,
been hearing it again and again. Yes, too many tests. If you could share details
too
on
many
that.
tests is a subjective term. A lot of
Okay.
times I feel too many tests which the patient has done and it was not needed. I also feel it. So it depends upon what, yeah. So it all depends upon what the patient has. It is individualization of the test. A lot of times patients are sometimes see that patient needs these tests, and as a physician, as a doctor, we write and they feel, oh my goodness, so many tests are done. But that is needed, right? And it can be also the other way around that the patient himself is coming with so many tests, which is not needed. So too many tests, yes, it does happen. And even sometimes doctors feel it, and sometimes obviously the patients feel it. Yeah.
Okay. डॉक्टर हमारे हमारे अंदर एक इनबिल्ट ट्रस्ट होता है लैब्स को लेके कि हाँ ये एक अच्छी लैब है, रिकग्नाइज्ड है, तो ये सही रिपोर्ट्स ही हमें डिलीवर करेंगे. बट क्या लैब्स में जो एक्सपर्ट्स हैं वो किस तरीके की मिस्टेक्स कर सकते हैं, या कभी आपने ऐसा कुछ एक्सपीरियंस किया हो, सो दैट व्यूअर्स शुड आल्सो बी अवेयर ऑफ.
Yeah, correct. So I think ESR values, etc. Normally, which is the CBC ESR, which is very common. So ESR values, if it's not done properly, then they can vary. CRP reports can vary, especially when it comes to microbiology. So cultures, the blood cultures, they have to be done properly. A lot of labs, we are evolving in this. They have to be appropriately done. जब हम सैंपल कलेक्ट करते हैं तो सैंपल कलेक्शन हैज टू बी क्लीन कलेक्शन, क्विक ट्रांसपोर्ट टू द लैब. ब्लड कल्चर अगर आप ले रहे हैं और कंटामिनेशन मतलब कलेक्शन साइट ही ठीक तरीके से प्रिपेयर नहीं हुई है, सो इट कैन रिजल्ट इन क्रॉस contamination. Similarly, urine routine, urine samples. So we have to explain to the patient also that it has to be clean catch of the midstream urine sample. मतलब कि शुरू का पार्ट डिस्कार्ड करके बीच का सैंपल ही देना होता है, not शुरू का, because if the initial part is given, it will result in contamination and it will result in a positive culture. Again, transport to the lab, and even as a has to be inoculated properly, and during the whole process, like the process also has to be clean. So there's so many steps where one has to be vigilant, and each of these steps have to be given importance.
Okay. Doctor, how can we balance caution with over testing? How do we balance caution with over testing?
Yeah, so caution and over testing is it has to be balanced with a proper history. When a patient, that I think will begin from monitoring your own symptoms from the patient side, and when a patient is consulting a physician or a doctor or clinician, then from the clinician side, that what are the likely symptoms, what the patient is having, and which is the likely organ which is affected, or the likely infection or disease which the patient is having, and then ordering the investigations according to the syndrome so that we can arrive at a particular diagnosis.
So thank you very much, Doctor, for your time. We really appreciate your information. It was a very informative session. And thank you very much for your time. You have a wonderful day ahead.
Thank
Thank
you
you
so
very
much. Thank
much.
you so much to you. Thank you for having me. It's a pleasure. Thank you.
Thank you.